Hello, my name is Professor Dr. Michael Weber. I'm orthopedic and trauma consultant at BR Medical Suites. I'm specialized in limb lengthening and limb reconstruction, as well as in pediatric orthopedics and foot surgery. Limb lengthening means the artificial introduction of growth. It works like a normal growth with a difference. For example, in adult people, they are not growing anymore. You have to cut the bone in a special way to preserve the blood flow of the bone. You have to stabilize the bone with internal methods or with external fixation. And then you wait until the bone wants to heal by itself. And at this time, you start after 1 week or 2 weeks with gradual lengthening, distraction of the bone, 1 millimeter a day. And a miracle happens. The organism, the human body, produces not only bone by itself, also the whole soft tissue envelope growth. The nerves are growing, the tendons are growing, the vessels are growing, as in a child. And during this time, usually, if you use external fixator, the patient can walk on it. The patients who need that have different diseases. First of all, acquired deformities due to trauma, heavy injury, damaging the growth plates, which are responsible for the growth. Huge number of patients, especially here in UAE, are congenital deformities. Children who are born with defects at the limbs, with shortening, severe malformations, even missing bones. In these patients, we can do this deformity correction as well. Also, we can construct new limbs with special techniques I have inaugurated. We have especially 2 different methods. One is the external fixation. This is a so-called Taylor spatial frame. The limbs are fixed with half pins or with wires, which are inserted inside of the bone. The bone is here inside. And after the bone is fixed properly over these rings, the half pins and the wires are connected to this ring, the bone will be cut, and then we can do the lengthening. The other option, and this is also a very interesting tool, is the fit bone technique. This is a device, this is like a nail, which will be implanted inside of the bone. Every bone has a hole inside, a so-called medullary canal. And you inserted it inside of the bone, you fix it with 3 screws, yeah? And then you can do a lengthening. We have to do physiotherapy. Yeah? If you do a lengthening on a bone, the attached muscles try to bend the adjacent joints into contractures. And on a routinely basis, also minimum 2 times a week, the patient has to undergo physiotherapy to prevent this contracture. And this is not pain-free, but all of the patient can do this, and it's reasonable. The advantage do limb lengthening is for the patient with these severe diseases, with this severe lack of bones, with this history of infection of the bones where they have to resect bone segments, is of great advantage. Yeah? And in my experience, these patients benefit a lot from doing this type of deformity correction and lengthening.